Have you ever wondered if your daily walk might be doing more harm than good? It sounds counterintuitive, even strange in a world where walking is seen as the holy grail of healthy aging. But here's the truth. Sometimes the very act meant to keep you strong and independent can actually be quietly draining your energy, straining your heart, and putting your safety at risk. This isn't fear, it's wisdom. And today, we'll uncover what most doctors don't talk about openly. The 5 types of seniors who should reconsider their walking routines, and what to do instead. Stick around to the end, because the last type might just surprise you the most. Walking has long been hailed as one of the best forms of exercise for seniors, offering a low-impact way to stay active, maintain mobility, and promote cardiovascular health. However, like all exercises, walking isn't one size fits all. For some seniors, walking can become a challenge rather than a benefit, leading to unforeseen consequences like muscle strain, joint pain, or even a higher risk of falls. The truth is, the impact of walking varies depending on a senior's individual health, fitness level, and existing conditions. If you have arthritis, heart disease, or balance issues, for example, your walk might end up causing more harm than good. That's why it's essential to recognize the signs that your walking routine might need a serious reassessment. In this video, we'll explore the types of seniors who should be mindful of their walking habits and offer alternative activities to help them stay fit and healthy without putting unnecessary strain on their bodies. Number 1. Seniors with unstable blood pressure. Seniors with unstable blood pressure face a unique set of challenges, especially when it comes to physical activity like walking. Blood pressure that fluctuates can make even the simplest daily tasks feel uncertain. One moment, a senior may feel completely fine, and the next they could experience dizziness, lightheadedness, or even fainting. These sudden changes in blood pressure are unpredictable, and they can be incredibly dangerous if not carefully managed. What's even more worrying is that many seniors tend to miss these warning signs, attributing them to something temporary or trivial. This disregard can lead to more severe health risks, such as falls or more serious cardiovascular events, making it essential to take proactive steps to manage the condition. Blood pressure instability is often a silent problem. It may not always show immediate symptoms, so seniors might not realize just how much their blood pressure is fluctuating. For some, these fluctuations might be minor and go unnoticed, but for others, they can be more dramatic and pose a serious health risk. The inconsistency in blood pressure can leave seniors feeling vulnerable, particularly during physical activities that require balance and endurance, like walking. Doctors' advice is critical in helping seniors navigate the challenges of fluctuating blood pressure. First and foremost, it's important for seniors to check their blood pressure before embarking on any physical activity, especially walking. This simple step helps ensure that their blood pressure is within a safe range and reduces the risk of any unexpected health issues while walking. Additionally, walking alone, particularly on uneven or unfamiliar terrain, is not recommended for seniors with unstable blood pressure. Even a minor misstep or a sudden drop in blood pressure could lead to a fall or injury. Having a walking buddy can provide added safety, offering support and assistance if needed. A companion can also help in situations where the senior might feel faint or dizzy, ensuring they get help immediately. When it comes to choosing where to walk, seniors with unstable blood pressure are encouraged to opt for flat, indoor paths or areas with stable footing. Malls, community centres, or indoor walking tracks provide controlled environments that are free from uneven surfaces or unexpected obstacles. These settings not only reduce the physical risk, but also offer a safer and more predictable environment, allowing seniors to focus on their health without the added stress of worrying about the terrain. In conclusion, while walking is an important form of exercise for seniors, those with unstable blood pressure must take extra precautions. Checking blood pressure before walking, avoiding solitary walks on uneven ground, and choosing indoor flat paths are all vital strategies to ensure a safer, healthier experience. It's essential for seniors to listen to their bodies, seek regular medical advice, and make walking a safe, enjoyable part of their daily routine. Number 2. Seniors with advanced joint degeneration. As we age, our joints naturally begin to show signs of wear and tear. This process is accelerated in seniors with advanced joint degeneration, where the cartilage that cushions the bones gradually breaks down, leading to pain and stiffness. These individuals may feel like their joints are constantly working overtime, trying to support the body through daily activities. The natural aging of joints, combined with the added strain of repetitive movement from long walks or strenuous physical activity, can lead to a vicious cycle of inflammation, increased discomfort, and sometimes irreversible damage. One of the most common areas affected by joint degeneration in seniors is the knees. Over time, the cartilage in the knee joint can thin out, causing bones to rub together. This friction can result in inflammation, swelling, and a significant reduction in mobility. In more severe cases, this degeneration can progress into osteoarthritis, a condition that makes it increasingly difficult for seniors to perform routine tasks, like standing up from a chair or climbing stairs. Walking, a simple and often recommended form of exercise, can ironically exacerbate the situation for seniors with joint degeneration. While walking is generally low impact, long-distance or high-frequency walking can put unnecessary pressure on already compromised joints. The repetitive stress can lead to further degradation of the cartilage, intensifying pain, inflammation, and swelling, especially in the knees and hips. To protect joints and manage the progression of joint degeneration, healthcare professionals often advise seniors to make modifications to their physical activity routines. Replacing high-impact walks with low-impact activities is one of the best ways to keep moving without exacerbating joint pain. Activities such as swimming, cycling, or using an elliptical machine provide excellent cardiovascular benefits without placing undue stress on the joints. These exercises allow seniors to maintain their fitness levels while also giving their joints the necessary rest to heal and reduce inflammation. In addition to switching to low-impact activities, using walking poles or supportive footwear can make a world of difference for seniors dealing with advanced joint degeneration. Walking poles help distribute the weight evenly between the upper and lower body, reducing the load on the knees and hips. They also provide additional stability, which can be crucial for seniors who experience balance issues due to joint pain. Supportive footwear, on the other hand, provides cushioning and shock absorption, helping to reduce the impact on the joints with each step. Perhaps most importantly, seniors should never ignore joint pain. Joint discomfort is a warning sign from the body that something is not right. Ignoring pain or continuing to push through it can result in further damage. If joint pain becomes persistent or worsens, it's crucial to consult a healthcare provider who recommend the appropriate treatments, including physical therapy, medications, or possibly even joint injections to reduce inflammation. In some cases, surgical interventions may be necessary if the degeneration is severe. Adapting to joint degeneration means finding ways to manage pain and inflammation while maintaining an active lifestyle. By making these adjustments, seniors can protect their joints, stay mobile, and continue to enjoy a higher quality of life despite the challenges of aging joints. Number 3, seniors recovering from surgery, understanding the healing journey. Post-surgical recovery is a delicate process, especially for seniors. The body is in a state of repair, and it's crucial to approach this period with patience and caution. The temptation to return to normal routines quickly is strong, but overexertion too soon can cause complications, not just in terms of physical wounds reopening, but in terms of setbacks to the healing process. In this phase, it's important to realize that the body's signals are essential guides. Doctor's advice: follow post-op movement guidelines. Strictly, after surgery, it's easy to feel like you should push through discomfort, but following your doctor's specific movement guidelines is essential. Each surgery has its unique recovery protocol, whether it's for knee replacement, heart surgery, or any other procedure. Deviating from these guidelines can disrupt the healing process, increase pain, and even result in long-term complications. Doctors may provide specific instructions about when to start walking, what range of motion is safe, and what kind of exercises are necessary for recovery. These guidelines are meant to protect the body and ensure that the healing process occurs at a safe pace. Remember, there is no rush in recovery. Each step needs to be deliberate and well-paced to avoid further injury. Focus on gradual, supervised recovery exercises. It's tempting to assume that the quickest way to get back on your feet is by pushing yourself to do more. However, the key to successful recovery is gradual progression. The body needs time to adjust to its new state after surgery, and sudden or intense movements can have the opposite effect, leading to setbacks. A rehabilitation therapist or physical therapist can be an invaluable partner in this phase. They will guide you through a recovery plan that includes gentle, controlled movements, progressively increasing in intensity. These exercises are designed to strengthen muscles, improve flexibility, and enhance circulation without putting too much stress on the healing area. Their expertise ensures that the right balance is struck, giving your body the chance to rebuild strength over time. Relying on professional guidance helps avoid mistakes like overstretching or lifting weights that are too heavy, both of which could lead to re-injury. Trust your fatigue. It's not weakness, it's communication. One of the hardest parts of post-surgery recovery is accepting fatigue. Many seniors may feel discouraged by the constant tiredness that comes after surgery, questioning if it's a sign of weakness. However, fatigue is the body's way of communicating its need for rest. Rather than pushing through tiredness, take time to listen to your body. Rest is as crucial as movement in the recovery process. It allows the body to repair itself and build the strength needed for full recovery. Pushing beyond your limits can lead to further complications, such as muscle strains, joint stress, or even cardiovascular strain. Fatigue is an indicator that your body is working hard behind the scenes, healing and replenishing energy stores. Give yourself the space to rest and recuperate as needed. It's a sign of wisdom to listen to your body, recognizing that fatigue isn't an obstacle but an essential part of healing. In summary, post-surgical recovery for seniors requires a mindful and patient approach. Adhering to movement guidelines, embracing gradual recovery exercises, and trusting your body's signals will ensure a smoother, safer healing process. Remember, recovery is a journey, and every step taken with care is a step towards regaining strength and vitality. Number 4. Seniors with peripheral neuropathy. Peripheral neuropathy is a condition that affects the nerves outside of the brain and spinal cord, often leading to a loss of sensation in the hands, feet, or other extremities. When seniors experience peripheral neuropathy, particularly in their feet, it becomes a significant challenge in daily life, especially when it comes to mobility. The loss of sensation means that the feet no longer talk to the brain in the way they should. The feet can't send signals to the brain about temperature, pressure, or pain, which can make it difficult to detect uneven surfaces, obstacles, or potential hazards. This leaves seniors at a much higher risk for falls, injuries, and other dangerous accidents. Walking becomes increasingly perilous because the lack of feedback from the feet means the person is unaware of where they are stepping or whether they are putting too much pressure on one part of their foot. One wrong step can easily lead to a fall, especially when walking on surfaces that are uneven or slippery. In some cases, the condition can also lead to muscle weakness and difficulty in coordinating movement, further complicating mobility. Aside from physical injury risks, this lack of feeling can lead to other complications such as pressure ulcers, sores that form from prolonged pressure on the skin, which are particularly concerning for seniors who may already have reduced skin integrity and circulation. The inability to feel injury or irritation can result in untreated wounds that become infected, which over time can lead to serious complications. If you or a loved one is dealing with peripheral neuropathy, it's crucial to make adjustments to ensure safety and maintain as much independence as possible. One of the first recommendations from doctors is to opt for flat, even, well-lit walking environments. Uneven surfaces are a significant hazard for those with neuropathy, as they can cause trips and falls. Walking outdoors on uneven ground, or even indoors where the lighting is poor, can increase the risk of injury. Ensuring a well-lit, clear path for walking indoors or using sidewalks that are even and smooth can reduce the risk of accidents significantly. In addition to choosing safe environments, seniors with peripheral neuropathy should add balance and strength training to their routine. Simple exercises such as standing on one foot for a few seconds at a time or doing leg lifts can help to improve balance and coordination. Strengthening muscles in the legs, core, and feet also helps in maintaining control and support while walking. These exercises don't have to be strenuous, but consistent, low-impact activities like walking on a treadmill or swimming can also benefit the overall strength and balance needed for daily movement. Lastly, there should be no hesitation in using assistive devices if needed. Some seniors might resist using a cane, walker, or other mobility aids due to a fear of appearing frail or dependent. However, assistive devices are designed to provide added stability and support, greatly reducing the risk of falls. These tools can offer confidence and allow seniors to navigate their environment more safely. It's important to understand that there's no shame in using these devices. On the contrary, they are empowering tools that can promote independence and provide safety. If necessary, a healthcare provider can offer guidance on the best mobility aids suited for an individual's specific needs. Ultimately, taking these proactive steps can help seniors with peripheral neuropathy feel more confident and secure in their daily routines, reduce the risk of injury, and improve their overall quality of life. Number 5. Seniors with unexplained fatigue or breathlessness. Unexplained fatigue or breathlessness in seniors is something that should never be brushed off as a normal part of aging. If you find yourself feeling winded after even short periods of walking, or if the exhaustion lingers long after you've sat down to rest, it's time to take notice. While it's common to experience a bit more fatigue as we get older, excessive or prolonged exhaustion, especially when it's associated with breathlessness, is often a sign that something more serious may be going on beneath the surface. This type of unexplained fatigue could be caused by a number of health conditions. For instance, heart disease is one of the most frequent culprits. When the heart isn't pumping blood efficiently, it can result in reduced oxygen delivery throughout the body, leading to tiredness and shortness of breath. In more serious cases, heart failure could be the underlying cause. It's crucial to monitor your energy levels and take note of any other symptoms that accompany the fatigue, such as chest pain or swelling in the legs. Another possibility is anemia, a condition where you don't have enough red blood cells to carry adequate oxygen to your tissues. This can leave you feeling weak, tired, and out of breath, particularly after physical exertion. Anemia can often go unnoticed in its early stages, as the symptoms might be subtle or attributed to other causes. A simple blood test can reveal whether anemia is to blame for your fatigue. Lung issues are also a common cause of unexplained breathlessness. Conditions like chronic obstructive pulmonary disease, COPD, asthma, or even undiagnosed lung infections can make it harder to breathe, especially during physical activity. If your breathing feels laboured, or if you experience wheezing, coughing, or tightness in your chest along with fatigue, these could be indicators of a lung problem that needs medical attention. If you're experiencing unexplained fatigue or breathlessness, the most important thing to do is not to normalise these symptoms. Your health is valuable, and ignoring symptoms could lead to more severe complications down the road. It's crucial to discuss your symptoms with your doctor promptly. A healthcare professional can run tests to rule out or diagnose conditions like heart disease, anemia, or lung problems and provide the appropriate treatment. In the meantime, consider using a pulse oximeter, which is a small device that measures the oxygen levels in your blood. If your oxygen levels drop significantly while walking or performing other activities, it could be a sign of a serious underlying issue. In addition, walking in safe, supervised spaces can provide reassurance if you're unsure whether your breathlessness or fatigue is related to physical exertion or something more concerning. Always make sure someone is with you or within easy reach if you need assistance. Taking care of your health is about more than just listening to your body. It's about taking proactive steps and seeking help when necessary. Remember, staying active and maintaining good health is important. But unexplained fatigue or breathlessness is not something to ignore. Always err on the side of caution and consult with your doctor to ensure you're living your golden years in the best health possible. Part 2. What to do instead. Just because you should walk less doesn't mean you should move less. In fact, it's important to find alternative exercises that promote mobility, flexibility, and strength without putting too much strain on your joints or risking further injury. Here are some safe, effective alternatives to walking that can help you maintain your health, protect your joints, and support your independence. 1. Water aerobics. Water aerobics is a fantastic way to exercise without putting stress on your joints. The buoyancy of water supports your body, reducing the risk of injury while still providing a good workout. It helps improve cardiovascular health, increases strength and flexibility, and is easy on the joints. Whether you're doing water walking, swimming, or water-based strength exercises, the resistance of water makes the muscles work harder, providing a full body workout. For seniors with arthritis or joint pain, water aerobics can offer a highly beneficial and gentle form of exercise. 2. Chair yoga is an excellent option for those who need a less physically demanding exercise routine but still want the benefits of yoga. This practice allows you to perform yoga poses while seated or while using a chair for support. Chair yoga helps improve flexibility, balance, and strength while offering deep relaxation. The seated position makes it a great choice for people with limited mobility or those who are recovering from an injury. The gentle stretching and breathing techniques can also help reduce stress and improve mental well-being, which is just as important as physical health. 3. Tai Chi. Chi is a low-impact, slow-motion exercise that has been practiced for centuries to improve balance, flexibility, and mental focus. It's especially beneficial for seniors because it improves muscle strength and joint stability, which can help prevent falls. Tai Chi involves a series of fluid movements and deep breathing, which can help reduce stress and promote relaxation. Studies have shown that Tai Chi can help improve posture, enhance coordination, and improve overall physical function. Many communities offer Tai Chi classes for seniors, so it's worth exploring if this practice resonates with you. 4. Seated strength training. Seated strength training is a great alternative to walking, as it allows you to build muscle without the need to stand for long periods. Strength training exercises such as seated dumbbell lifts, leg presses, or resistance machine exercises can help maintain muscle mass and bone density, which are important for healthy aging. By working your muscles regularly, you can improve your balance and endurance, making daily tasks easier and helping you stay independent for longer. Seated strength training can be done at home or in a gym, and many exercises can be modified for your individual needs or limitations. 5. Resistance band workouts. Resistance band workouts are an effective way to build strength, improve mobility, and increase flexibility, all while being gentle on your joints. Resistance bands come in various levels of resistance, allowing you to tailor the workout to your fitness level. Exercises using resistance bands can target specific muscle groups and can be done seated or standing depending on your ability. These bands are portable, so you can easily take them anywhere, whether you're at home, at the park, or even traveling. Incorporating resistance band exercises into your routine can help maintain muscle tone and support joint stability. 6. Recumbent biking. Recumbent biking is an excellent way to get your cardiovascular exercise without putting undue stress on your hips, knees, or back. The recumbent bike offers a comfortable, supportive seat with a backrest, which makes it a great option for seniors or those with mobility issues. It allows you to cycle with a more relaxed posture, reducing strain on the lower body while still providing a good cardiovascular workout. Using a recumbent bike regularly can help improve leg strength, endurance, and heart health while minimizing joint discomfort. It's also a low-impact exercise that's easy to modify based on your fitness level. These alternatives are all wonderful ways to maintain physical activity while minimizing strain on your body. Whether you're dealing with joint pain, recovering from an injury, or simply looking for a change in your exercise routine, these options can keep you moving, improving your health, and feeling more confident in your daily activities. These exercises are not just about staying physically active, they also help preserve and enhance your independence. They focus on building strength, improving balance, and enhancing mobility, all of which are key factors in aging gracefully and maintaining a high quality of life. By incorporating these alternatives into your routine, you can protect your joints, respect your body's healing process, and continue to live with vitality and independence. Walking is beautiful. It's a gift we sometimes take for granted in our youth, but as we age, it's no longer just about movement, it's about how we move. The simple act of walking can be a profound reflection of our life's journey. Yet wisdom teaches us that sometimes less is more. Aging with grace doesn't mean pushing through pain. It means listening deeply, adjusting bravely, and living fully. When we talk about movement, it's essential to consider not only the physical act, but the underlying emotional and spiritual connection to it. As we age, our bodies change. The knees may creak, the back may ache, and walking may not feel as effortless as it once did. But that doesn't mean we have to stop moving. Instead, it invites us to embrace a different approach, one rooted in mindfulness and compassion for our own needs. If you felt seen in any of these stories, I want to remind you, you are not alone. Every wrinkle, every sore muscle, and every slow step is part of the beauty of aging. It's not the end of your movement story, it's the beginning of a new, wiser chapter. There's no need to rush. The journey ahead can be filled with rich experiences if we allow ourselves to embrace each moment with a sense of purpose and care. This is where the heart of the matter lies. Movement should nourish us, not deplete us. It should uplift us, not wear us down. We don't need to walk a marathon every day to feel alive and vibrant. Sometimes just a few mindful steps can open up a world of possibilities. The body will respond in kind when we listen to its needs with love and respect. As a doctor, I've seen countless examples of individuals who've come to understand the power of pacing themselves. It's not about the number of steps, but the quality of those steps, whether it's a gentle walk through the garden, a slow stroll down a quiet path, or even moments of stillness, allowing your body to rest and recharge. Movement, when done with intention and care, becomes an act of self-love. When we push ourselves too hard, we risk more than just physical discomfort. We lose sight of the joy that movement can bring. Let me remind you, there's no shame in slowing down. In fact, slowing down can open the door to deeper connections with yourself, with nature, and with those around you. As we wrap up today's discussion, remember this. Aging is not about losing what you had, but finding what you can still cherish and embrace. You are in the driver's seat of your life's journey. You get to decide how you move, when you move, and why you move. Movement should nourish, not deplete. It should lift you up, not wear you down. If this video touched you, please share your story in the comments below. What changes are you making to your routine? Let us know. Don't forget to like, subscribe, and ring the bell so you won't miss more insights like this from Golden Years Balance. Thank you for spending your time with us today. Your health, your pace, your path.